My name is Sunil Thakersee and you're watching Melo TV. We are at Melomed Gatesville, where we are joined by resident cardiologist Dr. Sunil Thakersee, who explains a procedure that breaks down calcium. Now, the procedure is unique and it's called Shockwave Intravascular Lithotripsy. Yes, Dr. Sunil Thakersee.
So shockwave intravascular lithotripsy is a new form of treatment that's available to us in the cath lab to make the blood vessel more compliant and allow us to have a more optimal result with stenting. It's used especially in patients that have very calcified or hardened coronary arteries. What the shockwave does, it cracks the calcium and allows better expansion of the stent and better deployment of the stent, which equates to a better long-term result, both acute and, as I said, chronic long-term result. A way of optimizing and preparing the blood vessel and allowing a better outcome. We use it in specific patients where we've identified extensive calcification of the arteries. Calcification of the coronary arteries has been almost the Achilles heel of coronary intervention. One of the main reasons with that is to get the stent down to the vessel. It's quite difficult with the calcium, and secondly, to deploy the stent adequately and get an optimal result is a challenge. So with the use of intravascular lithotripsy, we are able to get a balloon down to the vessel, to debulk the vessel, to crack the calcium, both the superficial and the deep calcium, which then allows for adequate expansion of the stent. Well, initially the procedure works by having a catheter attached to a generator, and the catheter is then attached to a balloon. The balloon is then delivered down to the area of stenosis, and sonic energy, pulses of sonic energy is then given off by the balloon, and this targets calcified areas. It doesn't damage the remainder of the blood vessel. So the procedure is associated with a very good outcome, but most importantly with a very significant safety element. And as I've said previously, you're getting better deployment of the stent, optimal deployment of the stent, which is a major predictor of long-term outcome with stenting. Often with the calcified vessels, you don't get adequate stent deployment or apposition to the wall, and that lends itself to short-term and long-term complications. So this is something that would result in better long-term outcomes, especially in a selective group of patients, which we would probably not be able to even do stenting and often refer them for surgery, because we know that with stenting we may not get a good long-term result. So I think it's an avenue for a certain group of patients that have significant calcification of their coronary arteries. And we see this a lot in diabetic patients, but more importantly in the first patient that we did here that had chronic renal failure. Those patients have accelerated atherosclerosis and they often have calcified arteries, which is a real challenge in terms of how to treat these patients.
Well, there we heard from Dr. Sunil Thakersee, and if you are interested or would like to know more about the procedure, the contact details for Dr. Thakersee is on your screen. From all of us at Melomed, please look after yourself and look after your family. Don't forget to vaccinate if it's your turn, sanitize, wash your hands, and social distance. Until next time, look after yourself and look after your family. Till then, goodbye.